Have you ever walked into a room and forgotten why you went in there? Maybe you're standing in the kitchen, staring at the fridge, and for a brief second, you forget what you were looking for. Or perhaps you've told a story to your friend only to hear them say, "You already told me that yesterday." If you're over 60, you may have brushed these moments off with a smile and said, "I guess I'm just getting old." But what if I told you these little slips might be your brain quietly asking for help? I'm Dr. Ethan Wells, and today we're going to talk about something every older adult and every family member needs to hear. 10 early signs of memory decline you should never ignore. Some of these may surprise you. Some may sound familiar. But all of them are signals that something deeper may be going on. Today's video isn't meant to scare you. It's meant to empower you. Because memory loss isn't just about aging, it's often about what we do or don't do to care for our brains. I'm Dr. Ethan Wells, and on this channel, we talk about real, practical ways to protect your health after 60 so you can stay independent, sharp, and strong for the people who matter most. Whether you're watching this from Florida, Oregon, or anywhere in between, I want to hear from you. Have you or someone you love experienced any of the signs I'm about to share? Leave a comment below your story. Could help someone else watching this video right now. And if you haven't subscribed yet, go ahead and do that now. Because every week, I'm here with evidence-based, doctor-approved tips to help you take control of your health as you age. Now, let's talk about why catching these signs early can make all the difference. As a physician, I've seen this story unfold far too often. A patient in their early 60s comes into my office, still active, still engaged, but something feels off. They tell me, "Doc, I keep forgetting people's names, even people I've known for years." Or, "I can't seem to follow conversations like I used to. My thoughts just vanish." And for many of them, the fear is real. They're not just worried about forgetting a birthday, they're worried about forgetting who that person is someday. Now, here's the truth. Memory loss is not an automatic part of aging. Yes, the brain changes over time, certain processing speeds slow down. But significant memory decline, the kind that interferes with daily life, is often preventable, or at least, it can be slowed down. And it all begins with recognizing the signs early. Because when these symptoms are caught at the beginning, what we call mild cognitive impairment, there's a real opportunity to intervene. Let me share one example. One of my patients, a retired engineer, came in because he kept losing track of conversations at the dinner table. His wife noticed he was repeating himself often. We ran tests. His labs showed a severe vitamin B12 deficiency, and his brain scan revealed some early changes. But here's the good news. After 4 months of guided supplementation, diet changes, and sleep optimization, he came back and told me, "Doc, it feels like someone turned the lights back on in my head." That kind of turnaround is only possible when we catch things before they progress. But sadly, many people don't act until it's too late. They miss the signs or mistake them for normal aging, and that delay can mean missed opportunities to protect their independence and quality of life. So today, I'm going to walk you through 10 of the most important early warning signs of memory decline. Some of these might be subtle, others may be more obvious, but all of them are worth paying attention to in yourself and in the people you love. 1. Frequently forgetting recent events. Have you ever had a conversation in the morning, and by the afternoon you barely remember it happened? This kind of short-term memory loss is one of the most common and earliest signs of cognitive decline. Why it matters? It's different from forgetting where you parked your car. This is about forgetting conversations, appointments, or important recent events, sometimes within hours. What to look for? You keep asking the same question. You forget that someone called you earlier that day. Or you can't remember what you ate for lunch again. Medical insight. This may be linked to changes in the hippocampus, the part of your brain responsible for forming new memories. It's also common in early Alzheimer's and B12 deficiency. 2. Trouble following plans or instructions. Let's say you're trying to follow a simple recipe you've made before, but you get confused halfway through, or you start paying bills and lose track of which ones you've already handled. Why it matters. When step by step, tasks suddenly become confusing, it may point to problems with executive function, the brain's ability to plan, organize, and sequence information. Real-world example. A patient once told me, "I've been balancing my checkbook for 30 years. Last month, I couldn't remember how to finish it." Possible causes: cognitive decline, side effects of certain medications, or even poor sleep. 3. Getting lost in familiar places. Imagine going to your usual grocery store, but halfway through the drive, you forget where you're going, or you miss a turn on the route you've driven for 20 years. This is serious. Spatial memory is a different system in the brain, and changes here can be an early sign of neurodegeneration. Advice: if you or a loved one gets lost, even once, in a familiar area, don't ignore it. Schedule a memory screening. 4. Difficulty finding words. You know what you want to say, but the word just won't come. You might call a television a box thing, or say hand clock instead of watch. Why it matters. This could be normal aging, but if it's happening frequently, or the person starts using vague or incorrect words regularly, it could indicate aphasia, often seen in early dementia. Watch for long pauses mid-sentence, substituting wrong words, or abandoning a sentence altogether. 5. Misplacing items in illogical places. We all misplace our keys now and then, but when someone finds their wallet in the freezer, or their shoes in the microwave, that's a red flag. This goes beyond distraction. It suggests the brain is no longer encoding information in the right context. What to do? Keep track of how often it happens and whether the person remembers they put it there afterward. 6. Withdrawing from social activities. Suddenly losing interest in hobbies, family gatherings, or church groups. This isn't just about personality changes, it can be a protective behavior. Why? People may sense they're struggling mentally, so they pull back to avoid embarrassment or confusion. In clinic, I've seen vibrant social patients retreat inward because they're afraid of forgetting names or repeating stories. 7. Personality or mood changes. Is someone you love suddenly irritable, anxious, depressed, or suspicious? Cognitive decline doesn't just affect memory. It can disrupt emotional regulation in the brain, leading to mood swings, paranoia, or even uncharacteristic aggression. Case in point. A mild-mannered patient of mine started snapping at her husband over small things. Tests showed signs of early-stage Alzheimer's, which explained the sudden behavior change. 8. Poor judgment or decision-making. Are you noticing risky financial choices, like giving away large sums of money to strangers over the phone? Or perhaps ignoring basic hygiene, or dressing inappropriately for the weather? These are not simply quirks. They're signs of impairment in the prefrontal cortex where judgment and reasoning live. 9. Repeating questions or stories. If someone repeats the same story word for word multiple times during one visit, that's more than nostalgia. It's an indicator that new information isn't being stored, so the brain circles back to what's familiar. Pay attention to how often it happens, whether they remembered telling you the story earlier that day. 10. Trouble with time, dates, or sequences. Does the person often forget what day or month it is? Do they struggle with the order of events, like what happened first versus last? Why this matters: orientation to time is one of the first things we lose when cognitive decline sets in. It's why one of the first questions we ask in a memory screen is, "What's today's date?" Each of these signs on its own might be innocent, but when multiple appear, especially over a short period, it's time to take action. If you were sitting in my office right now, here's what I would tell you. Caring for your memory doesn't mean jumping to the worst conclusion or panicking every time you misplace your glasses, but it does mean listening to your brain because it's always communicating with you. When patients come to me with early memory complaints, I don't start with a pill. I start with questions. What do you eat every day? Are you getting 7-8 hours of quality sleep? Do you challenge your brain with new activities, or are you stuck in the same routine? Are you socially active, or are you isolating yourself more lately? When was the last time your B12 or vitamin D levels were checked? And then I say this: memory loss is often a symptom, not a diagnosis. The real question is, what's underneath it? In my experience, many early cases of memory decline are linked to very treatable causes: nutrient deficiency, medication side effects, chronic stress, sleep apnea, uncontrolled diabetes, or even dehydration. Let me share the story of one of my patients, a 6-year-old retired librarian. She came in deeply worried. Her mother had Alzheimer's, and now she was forgetting conversations and losing her way on neighborhood walks. We tested her and found two things. Her vitamin D level was dangerously low. She had undiagnosed sleep apnea. 3 months later, after treatment, better sleep, and a personalized supplement plan, her symptoms dramatically improved. She cried in my office when she said, "I thought my life was over, but now I feel like myself again." That's the kind of transformation I want for you or for someone you love. But here's the key: you must act early. Waiting until the signs get worse often means lost time that we can't get back. So if any of these 10 warning signs sound familiar, write them down. Talk to your doctor. Ask for a memory screening. Get your labs done. Don't brush it off. Because when you catch it early, you give your brain the best chance to stay healthy, active, and alive. So let's bring this all together. Today we covered 10 warning signs of memory loss that you should never ignore. Forgetting recent events, struggling with plans or instructions, getting lost in familiar places, trouble finding the right words, misplacing things in odd places, withdrawing from activities, changes in personality or mood, poor judgment, repeating questions or stories, confusion with time or sequence. Any one of these signs on its own might not seem alarming, but when you start to see 2, 3, or more, it's time to pay attention, because memory loss isn't just about forgetting. It's about losing your confidence, your independence, and your connection to the people you love. But here's what I want you to remember. Your brain is not done growing. It's not done healing. And it's not done remembering if you give it the care it deserves. If you found this video helpful, please consider sharing it with someone close to you, a spouse, a friend, a parent. It might be exactly what they need to hear right now. And if you haven't already, hit that subscribe button and turn on notifications, because next week I'll be sharing a video on 6 foods that may be silently damaging your brain after 60. It's eye-opening, and I promise you won't want to miss it. I'm Dr. Ethan Wells. Live healthier, live wiser, starting today, and I'll see you in the next video.